There's a lot of people with a lot of unresolved anger issues and mommy and daddy issues. Even at, 60 years of age, they're still pissed off at mom or dad, or the ex-wife or the ex-husband. And I mean, like, when you start really getting into this stuff, you realize that, the head is a dangerous place to live. It's like, you don't want to camp out there, man.
Well, it's even scarier to continue taking orders from it too.
Well, exactly. Yeah. But for me as a therapist, it was like, God, I'm probably writing some of the best programs in the world, but the hardest thing in the world is to get these people to do them. They come crawling on their hands and knees. They'll even second mortgage their house. I'll tell them exactly how to get out of pain, and they go not do it. I'm like, what exactly do you think was going to happen here? And, this goes to a side note. One of the big problems we have, and you've heard me talk about this before, I'm sure, is we have the medical system has actually conditioned the public to believe that you go to a doctor or a therapist and they take your problems away. They take your pain away, which is why I say to my students, we do not operate on a treatment model. Because the instant someone thinks that they're going to Matt and they're going to pay 150, 200 or whatever it is for a treatment, they're going to get treated and they don't have to do anything but lay there. And then all of a sudden their headaches will disappear. Their back pain will disappear. And the way I make the point is I say, if I say I'm treating you to lunch, who do you automatically assume is going to pay? Of course you think I'm going to pay. But if I say I'm going to coach you today, you don't make the assumption that I'm going to do all the work. No coach goes out and plays for Kobe Bryant or anybody else. They tell you how to play. And so this is why I teach Chek professionals. We do not treat diseases that have people. We coach people that have acquired diseases, because otherwise you're in the medical system and that's they'll lock you up for that.
It's funny how you're talking about you writing a program and then the patient's not doing it. It just reminded me of when I used to work in Fitness First. I was working with a lady who said to me up front, I hate exercise, I don't like sweating, but I want to lose 20 kilos.
I've heard that lots of times.
Okay. So I wrote the program, did the program, and every Friday she would go to a seafood lunch with her girlfriends. And she was, in my opinion, she had a reaction to prawns, I think it was. But every Friday, I'd see her Tuesday, Wednesday, Friday, and every Tuesday she was puffy.
Yep.
Red, puffy. So, and I got to the point where, fuck, what are we doing? Seriously, I'm happy to take your money, but this is what's happening.
Yeah.
But what I realized, what it really clicked for me, and I remembered, what's her name? Is it Angelise Arian?
Angelise Arian.
Yeah. So the causes of addiction.
Yes, four causes of addiction, yeah.
And then I started to quiz her. I said, what was your childhood like? What was your relationship with your parents like? And they said, my parents were really strict. I said, okay. So then it clicked for me. When I was telling her to not eat the stuff that was causing inflammation, I was creating an unconscious knee-jerk reaction to rebel against mummy and daddy.
Yeah, very common.
And then as soon as I switched, how was lunch? How was the prawns? I just accepted it. That's when she stopped.
Yeah, very good.
And that's when the weight started to come off.
Yes. And that's exactly why I study the psyche so much.
Yeah.
These are really major, major issues. And they're challenges for all Chek professionals and anybody else out there, because, the problem is, and you'll know this to be a fact, the big problem is that very few people in the rehabilitation system, whether it be any kind of rehab, I don't care what it is, from behavioral to musculoskeletal to visceral to pelvic floor, they don't do proper assessments. So they don't know whether the programs they're giving are working or not. Right? That's why the Chek Institute teaches you how to use calibrated instruments to measure spinal curves and forward head posture and rib angles and pelvic tilt and weight shift and a load of other stuff, because the first thing that happens when the patient comes back, you find out, you get your own report card as a therapist. Because if they're doing the program and they're getting worse, you know it. So it's like, okay, either I'm missing something or I gave them the wrong prescription. And you've probably heard me tell this story, but I'll share it for the listeners. When I invented the forward head caliper, which, that was when I was, that was in my first year at Sports and Orthopedic. That was 1988. I realized I needed to have a way to measure this because it's too subjective. And I was suspicious because I investigated how did we come to the conclusion that the alignment for posture shown in books like Florence Kendall's Muscles, Testing and Function and many of the other famous books on posture and muscle function. How do we come to the conclusion that the right alignment is ear over shoulder, shoulder over hip, hip over knee, knee over ankle? Like, I wanted to know, how did they come to that? Do you know how they came to that? By looking at people that were dead laying on a table in a morgue.
Oh, I have heard that, yeah.
That's how they figured it out. So they said, this is what good posture is. It's all based on dead people. And so I said, okay, I need a way to measure this and start testing people. And so what I did is I made a habit of testing as many people as I could. And I was looking for people that had no pain, were fully functional, and had a healthy body. And so I would just go measure people all over the place. I'd measure teams of athletes. I'd measure, go to corporations, and, I'd go to put up a booth at a trade show or something and just invite people for measurements. And I had a bilateral scale and a plumb line, and I would take notes.
Hey, what if that scary, terrible thing in one of your dreams is actually a part of you trying to get the attention of the rest of you so that you can make important changes in your life right now? Could be health changes, could be relationship changes, could be how you're using your money. Well, principle number one of dream interpretation, that is a principle that is rarely ever broken, is that everything in your dream symbolically represents some aspect of yourself. If you want to learn how to interpret those dreams and learn a lot more about what your soul's trying to tell you so you can live and love fully, click the link below and join me in my upcoming dream interpretation workshop. You'll know you're supposed to be there because your heart will tell you so.
And so what I found through my own analysis, as an example, is that if someone's head carriage is 0 to 3 centimeters, it almost always is not a problem. Versus zero would be ear directly over shoulder or zygomatic arch directly over collarbone, which is the dead person laying on the table. But I found as long as their head was within 3 centimeters of that, going backwards, that's a problem. But if they had up to 3 centimeters of forward head posture, they could be completely functional. But once it crossed the 3 centimeter zone, the adaptation the body had to go through to balance the different centers of the body, the cranium, the torso, the pelvis, and the legs, led to too much chronic musculoskeletal stress in the field of gravity. But the point I'm making is people don't do follow-up assessments. So what they do is they just project their own bias on it, or just pretend that it's getting better because they don't want it to not be getting better. And so you end up with people just getting countless hours of therapy that's very, very ineffective. But the punchline of this is, once I invented the caliper and got a patent on it, I started running ads in physical therapy journals and chiropractic journals because I wanted to make money selling the thing. I thought it would be helpful to the industry to actually have a calibrated instrument. And it wasn't about 2 or 3 months. I might have sold, 100 of the things. And I got 3 of them back in the mail. And with letters saying, this instrument does not work properly. I don't think it's calibrated properly. And so I got a hold of each person, tracked them down, and said, it is a calibrated instrument. I said, I can prove it to you. And so I said, some of them had written me a letter and not sent it. And they said, I think there's something wrong with this instrument. So I would show them, okay, go put it up against a doorway. I'd show them there's no way it can be wrong because it's built in calibration. And so the punchline is this. I said, look, now that you know how to use it and that it's calibrated, do you want it back? And they would say, no. I say, why? They said, because every time I use it, the person's head carriage is getting worse. I say, do you realize that that's telling you that the therapy you're doing is making the patient's posture worse? Mm-hmm. Are you doing a bunch of abdominal exercise? Yes. Are you making sure they can breathe and you're stretching the abdominal wall? No. Are you doing strengthening for the extensor mechanisms of the body? No. So what you're doing is you're collapsing the rib cage and pulling the head forward. You're calling that therapy. And now you're telling me you don't want the caliper back because it's showing you the truth of your program. That's what the freaking thing's for. But they didn't want it back. They didn't want to know the truth. Yeah. And I was just like, oh my God, I can't believe this. Yeah. I was like, what is the world coming to? We have professional therapists that don't want to know the truth of their own therapy. They just want to bill people and go home and eat donuts. Poor posture and pain of musculoskeletal origin can cause dysfunction in the visceral system, so it can go backwards. Mm-hmm. Maybe you can share what you've observed with that. We did talk a little bit about car accidents and issues, but I'm talking more about the nervous system and how it functions, or anything you want to share so people understand. You don't have to actually injure the gland and organ. You can injure the body, and it can cause gland and organ dysfunction.
Yeah, I've found several cases with lordotic patients. And when I'm saying lordosis, instead of the curve equaling 30 to 35 degrees, they're like 50, 60 degree lordosis. What I find happens...
That's lumbar curve, everybody.
Lumbar curve, yeah.
Forward curve is lordosis. What
I found was that the mesentery of the small intestine, which crosses between, if you draw a line between the right ASIS and the left lower rib cage, that's where the mesentery sits, right on the spine. And to give you an idea of how strong it is, if you were to pick it up from a cadaver, the whole body would go with it.
Wow.
So what I was finding with lordotic patients is it was restricting blood supply to the mesentery and the small intestine. The mesentery provides the small intestine with blood. And so a lot of people end up with nutcracker syndrome, which is where the superior mesenteric artery comes off the aorta, but it can pinch the left renal vein. So a lot of digestive dysfunction. I find with a lot of kyphotic patients, they have a lot of tension in and around the lungs and the pleura.
For those listening, kyphotic means that your chest is dropped down and your head forward, so like a hunchback.
Yeah, so if you were to hunch really forward and take a deep breath in, you can feel where that tension goes straight away. Mm-hmm. So people will present with secondary neck and shoulder issues from that. And what I've found with people with poor posture, it puts an adverse mechanical tension on the phrenic nerve as well. And the phrenic nerve is the nerve in our body that holds any severe trauma or near-death experience. So it also not only affected the viscera, but also affected their psyche, because they were in a perpetual state of reliving that near-death experience.
Why don't you tell people where the phrenic nerve and what it does so they don't get lost?
So the phrenic nerve is the motor nerve for the diaphragm, but it also picks up tension from the visceral system and also communicates to both capsules in the shoulder. So the liver will communicate to the right shoulder capsule via the phrenic nerve, stomach to the left. But it's innervated primarily by C4. It does run from C3 to C5, but primarily C4. So anywhere along that nerve channel can present any kind of symptom. But what I found clinically is people with phrenic nerve tension didn't necessarily have neck tension, but they had one-sided rib cage tension or depression, Mm-hmm. And that often showed up as a scoliosis as well. But I found that the psychological theme running the show was they were always in danger.
Well, that'll affect your breathing pattern immediately.
Yeah, so they had just that constant tension.
Yeah, gridlock.
Yeah, and then also the vagus nerve as well, because the vagus nerve on its way up or down, however you want to look at it, it holds hands and touches the phrenic nerve. So often tension in one will affect the other.
Yeah.
And so often you have to work with both.